All right. Well, good afternoon, everybody. My name is Enos, and I am one of the supervisors of the prenatal to 25 lifespan behavioral health section. I know that's a mouthful. Within the Division of Behavioral Health and Recovery at the Healthcare Authority. Thank you for giving us an opportunity to present Transform to you today. I wanted to start off by giving you just a quick overview of what to expect during this presentation. So to start off, my fellow section teammate in the P25 team, Zazie, and I will share some brief remarks about the project. And then you'll get an overview about cognitive behavioral intervention for trauma in schools, followed by an overview about Transform. And then you'll get to see Transform in action because we'll be doing a little bit of a demonstration for you. And then we'll talk about where Transform is going before we close out with opening it up for some questions. And so before I go into some of the remarks, I do want to start off by saying we'd like to thank the development team, for this work that they're working on, and also for actively including us as advisory team members in the process. I would also like to thank our HCA leadership, for their wholehearted support of this impactful body of work. And then lastly, I want to take a moment to thank my fellow advisory team members for helping create an environment where we all feel safe being very vulnerable while we're discussing the elements of this story, and also leaving space for us to talk about how.
So Anna's your mic muted.
You somehow ended up on mute, Anna. We can hear you.
Yeah.
Oh, I'm sorry about that. I apologize if you missed part of my introduction. But the piece that I'm going to go into now is just talking about why is this work important? Being able to create safe spaces for our BIPOC youth is extremely important. Because historically, a lot of people from marginalized backgrounds don't always get a chance to process their trauma or even really fully understand what trauma is. This gives an opportunity to do so. And for a more personal level, I am very excited to be a part of this project that is going to be so impactful to so many lives of youth across the nation. And also getting a little bit more personal, I think for me as a licensed therapist, I've always struggled on how to include my own personal story in the work that I've done with youth. And so this project gives me an opportunity to share a lot of elements of my story, specifically my identity. And my goal specifically is to hopefully reach those youth that look like me, or those that are immigrants, so that they can see that, regardless of the struggles that you go through, you can make through that. So thank you for giving me that time. Zazie, I'm gonna pass it on to you.
Thank you, Enos. Hello, my name is Zazie Wald. I'm the transitions lead on the prenatal to 25 team with Enos at the Healthcare Authority. And this has been such an incredible opportunity to get to be a part of this advisory group and to get to be part of the formation of this really innovative practice. I mean, what this practice is doing is not only helping disseminate trauma work, for racial oppression healing, but it's also increasing access. So we've had all of these patterns of behavior and systematic oppression. And what this gives the opportunity to do is really break those down and bring it to the schools so that people don't just have to come to a clinical setting and have access to a clinical setting. It's really creating a framework that not only innovates what trauma is, outside of ACEs, outside of, what we might see as the single trauma from PTSD, but it's highlighting that this is a serious issue that we get to tackle together to truly be anti-racist. And we are going to have the opportunity to create a new generation of young people who have a new framework and a new space for healing, which I think is the most exciting part of this. We get to come together, and schools are going to get to come together to really change the way that we treat each other and help make nurturing and healing environments rather than perpetuating the old things that don't work and just hurt folks. So I'm just so excited that we get to all work together, and thank you so much for having us here today to present this really innovative practice to you. And so it is with great honor that I get to introduce Dr. Johnson, who is one of the creators of this practice.
Thank you so much, Saji and Enos, for that beautiful introduction and opening. And I want to thank everyone for your time and spending your lunch hour with us. Hopefully you got to eat something before joining, or you're eating now or afterward. But we're very excited to share this program with you. I'm going to share my screen. We put a little PowerPoint together. And so my name is Dr. Lau Johnson. I'm a licensed psychologist and nationally certified school psychologist. I recently took a position with the UCLA Duke National Center for Child Traumatic Stress. We are a Category 1 site that's funded by SAMHSA, and we're a coordinating body for the NCTSN, which some of you may be familiar with. It's the National Child Traumatic Stress Network, the network of sites across the United States that focuses on providing access to care specifically for child trauma. So I'm the assistant director for service systems in that center. I wanted to acknowledge a number of organizations that is helping to collaborate in this work together in creating Transform, which stands for Trauma and Racism Addressed by Navigating Systemic Forms of Oppression Using Resilience Methods. We're very excited about this program, and it's focused on really thinking about systems-induced trauma and really thinking about a decolonized approach to addressing trauma. And we will walk you through the program goals, the objective, our timeline, and go over some content with you today. I just wanted to give some history around how Transform even came to be. This project is funded by OJJDP, and currently, and oh gosh, like 2 or 3 years ago, we had an OJJDP grant where I actually did a different research project in a juvenile justice facility, Echo Glen Children's Center. And at the time, I was a consultant psychologist and asked to help just with the screening process for trauma at Echo Glen. And to nobody's surprise, we found a number of young students, almost 90% of the young students scoring at least about 80 to 85% of the students fell within at least the moderate to severe range in trauma symptoms. So at the time, we didn't really have this targeted program to address trauma specifically. There was a pretty robust DBT program, but not a robust targeted trauma program. So we decided to put a small pilot together, and I'm just putting the picture together of the facility, which is just pulled from Google. And this is just the inside of one of the cottages of Echo Glen, and this is an aerial view of the facility. And it's really rooted in rehabilitation. And so they agreed to let me do this small pilot in 2017 to train some of the direct care staff who don't have a license to practice for providing mental health services, but to train the direct care staff on delivering CBIS, which is an evidence-based treatment program that stands for Cognitive Behavioral Interventions for Trauma in Schools. And I wanted to see, is it feasible to train line staff in an evidence-based program that's designed for licensed professionals? We wanted to see, will they even like it, and will the kids like it? And with that small pilot, we found promising results, and that led into a larger, more robust study that we conducted in 2018. So I can share the results of that study with you in a moment. I'm going to actually share some clips of a video that we put together that shares a little bit about the larger robust study that we conducted that focused on actually addressing racial trauma. So in the small pilot we did, I found that the young people were wanting a space to talk about the impact of racism in their lives. And with the staff that were predominantly white, some of the students were really communicating that it was difficult to engage in conversation with the staff about the impact of racism in their life. So we wanted to try and find a way to build capacity for staff and build their level of cultural humility, engage in effective conversation when it came to the impact of racism and addressing trauma. So the clip of the video that I'm going to share are some kind of snippets of interviews of some of the staff who participated in the larger study and communicating the impact that program has had on their delivery of care. So I'm going to shift my video and I'm just going to play a few minutes. I believe the link to the video has been sent to you all, so you can watch the full 10 minutes on your own time. And so again, I'll just be playing a couple minutes of the video right now.
You've tried to help me through it.
I do see that with the girls that I work with. They tell stories of how, you know, they are afraid when they get pulled over. They're afraid of police. They're afraid to trust a lot of white people. They're afraid in their schools and stuff. And so the fear really kind of, I'd never really, I guess, paid much attention to it. But, you know, because I grew up in Montana and like I never, you know, was exposed to the way the world really is in a lot of ways.
Oh, you speak English well for African. How come you don't have an accent? You weren't born here, you know?
I got that too.
I got that before a lot.
I think addressing trauma that children have experienced, particularly with children who have offended in the community, frequently come from broken family situations, often have mental health issues, substance abuse issues, a whole host of just life-wrecking issues occurring in their lives. To try and help those children without addressing traumas that they've experienced is really to stick our head in the sand about probably some of the most important issues driving why they're engaging in some of the behaviors they are.
In institutions, how to have the conversations with young people about racism. These young people don't really have those conversations. They never have those opportunities to have those conversations. And staff will feel uncomfortable having those conversations because it's not something that is a topic that is discussed in the system. People don't get to hear the bluntness or the realness because everybody shies away from it, and most young people don't never have space to have that conversation. And staff and administration are never gonna open up that door. Why would they? You know, and be uncomfortable on purpose? No, they're not gonna do that. So we're giving them the opportunity to be uncomfortable, but also put them in a place to feel more comfortable being uncomfortable, having a conversation about racism.
In order for staff to even have that conversation with you, we need to have the conversation with staff to increase their own awareness and admit first, racism exists, microaggressions happen, we all have unconscious bias, and they can negatively impact other kids.
So because of this training, I feel that I can understand the kids that I work for in better ways, and I can understand what they've gone through, relate more to what they're experiencing in their lives. And I just feel like it's opened my eyes to a lot more of the issues going on in our world that our kids are facing in their daily lives in the community.
Kids were actually able to take some of what they were learning about how to manage difficult conversations, and they were demonstrating like deeper level understanding by some of the stories that they were telling of experiences occurring in their own lives.
If you reduce the traumatic stress, increase the understanding.
Great. Well, I'm going to drop the link to the full video in the chat and invite you all to watch the full 10-minute video on your own. But hopefully those snippets were helpful in sharing a little bit about the CBITS Racial Trauma Module research project. I did want to be pretty transparent and honest around the difficulty it was to implement that module within CBITS, mainly from fears of some administrators concerned if we talked about race in a child serving institution, is that really the right setting? And so we had a lot of really great dialogue around this can be done in a way that's effective with the right amount of training and consultation, but it will require work on the adults and the staff part 100% before we engage in conversation with our young people. I wanted to share the results of the study that we conducted in 2019. I'm happy to share the research report that's actually been published on the DCYF website, and I can also connect with Rachel and Kim on getting you all the PDF of the report as well. So we conducted a study looking at the feasibility, acceptability, and behavioral health outcomes of integrating a racial trauma module in an existing evidence-based program. And we wanted to see if it would generate good results. And we did do research around what happens if you modify or add components to a pre-existing evidence-based program. And the research supports that it can be a serious threat, or it can really enhance effectiveness. We do have a strong base of research to indicate that racism contributes to racial trauma and it needs to be addressed. And so all of that taken together, we felt confident to modify an existing evidence-based program and move forward. Here were the results of that study. So we looked at feasibility, and that was looking at, can staff be trained to implement this program, essentially? And so 2 CBITS certified trainers randomly listened to 20 randomly selected audio recordings, and they scored 80% or higher. On the racial trauma module, they scored about 72% or higher. So those were really good results. We saw a positive trend for treatment effects on depression. And we also found good results for our youth of color. And I just want to take a moment to ensure that I'm taking care and explaining that result. Students were asked to fill out a questionnaire before the program to identify 10 different scenarios that they may have experienced in the past. And the questions were, have you ever been treated unfairly by a teacher? Or have you ever been followed around in like a grocery store? And if they would check off yes, they would have to indicate, you know, why do you think this happened? And they would be able to check off, you know, maybe with my race, the color of my skin, my language, and then they would be asked, how did that situation make you feel? And what we found actually was that young people of color would identify yes and say, I think it was due to my race, but they would say, you know, I didn't really care. It didn't bother me. I had, you know, no negative feelings about it. After the program, we were finding that our youth of color were able to better identify that these scenarios actually made them pretty upset and identified negative feelings associated with those situations. And that feels counterintuitive, but that's actually really important to note because our youth of color are being desensitized to being discriminated against or experiencing racism, that they've internalized this idea that maybe it's just normal, and I don't have a right to feel upset about it. And then the last thing we looked at was acceptability, and that's checking to see, did the kids like it and did the staff like it? And so again, we'll send that report to you all to look at the results in more detail. And so I really want to emphasize that there's a ton of research to document that the experience of racism is traumatic. And we're not doing a good job capturing it in our screening. We're not doing a good job treating it. And it really should be treated at a systems level. And we certainly don't have great interventions or a number of interventions that treat it at the individual level. We know that racial and ethnic disparities exist. And we have enough evidence to show that our youth of color, our families of color, are seeking treatment at much lower rates compared to those who are white. And we also know the rates of PTSD are much higher in Black, Indigenous, and people of color population. So this background, so we've created this racial trauma module that's integrated in CBIT, and that training is available, but we've now actually developed Transform, and we're in the process of this program. And we find it to be very important because we wanted a program that holistically addressed trauma and racism as its own program in itself. So the goal of Transform is to ensure that from the start of development, it is evidence-informed, we decolonize strategies and approach. It's led by Black, Indigenous, and people of color experts with both lived experience and professional experience. And it's really designed for BIPOC youth at the center. Our goals for Transform, and it's a group-based model with about 10 gatherings. So we're calling them gatherings and not sessions. That's with intention. So it would invite about 6 to 8 youth to participate in a group, and it can be implemented by both clinicians and non-clinicians. And what we strive for in the program is to increase what we call racial awareness and its impact. We actually want that for both the youth and the adults. We want to increase knowledge base on the impact of trauma. We want to reduce stress and/or trauma-related symptoms among the youth. We want to increase coping strategies for children and adolescents impacted by both trauma and racism. And we want to increase the adults' skills and self-efficacy to address trauma and/or racial stress and trauma in the school and juvenile justice system. Really wanted to point out that our team is intentionally composed of predominantly BIPOC professionals and individuals to design this program because the field is really dominated by developers and researchers that are white. Representation is really critical for BIPOC youth so they can see themselves in various spaces and to have their voices represented in programs that they participate in. This is the core development team of the manual. So it's myself, Dr. Farzana Salim, who's actually here with us today, and she is phenomenal. We have Dr. Isaiah Pickens and Dr. Audra Langley. We also have this phenomenal advisory board, many of who are here with us today and have really helped to provide really important feedback ongoing, iteratively. And because of their feedback, we continually make sure we update the content to make sure that it's culturally responsive and that we're continually centering BIPOC youth. We also have some outside folks providing consultation and expertise to the content. And Dr. Farzana Salim is going to talk in a minute about the theoretical base of Transform. And one of it is radical healing, and another is really looking at racial literacy. So I just wanted to point out that Dr. Helen Neville is one of really the key writers and researchers around radical healing. And Dr. Howard Stevenson is one of the key kind of original researchers around racial literacy. And so we've been very fortunate that they provided their expertise in this as well. And I absolutely want to acknowledge our partner, Community Passageways, and we do focus group with the young people with community passageways. So we do the material with the kids and they give their feedback, extremely honest feedback, and it's been really invaluable for the content. So I'm actually going to pass the mic right now to Dr. Farzana Salim, and she's going to review the theoretical and evidence-based of Transform.
Hi, everyone. Thank you so much for that. I'm excited to be here and happy everyone is here with us today. Yeah, I'm just going to quickly do a fast overview here of some of the theories that are informing the development of this work. And we, again, as mentioned previously, we really are trying to take a decolonized intervention approach when we're thinking about this. And the part of that is, you know, taking some components from empirical interventions that we know are helpful, right? So components of cognitive behavioral therapy, for example, which is one of the most kind of well-known and effective treatments for addressing trauma, having some of those components integrated while also recognizing the need to do this collectively, right? And to be able to look at both the intersection of racism and trauma and how those things are working together to impact outcomes for youth. And so the ways that we're doing that are, you know, thinking through integrating this framework around radical healing, as well as a framework around recast. And so we're happy to, if folks have questions about these, because we'll have to do a briefer introduction today, but if people have questions about these frameworks, we're happy to provide resources. I'll just mention for radical healing, essentially this framework is thinking beyond this individual level approach to coping with racial trauma for BIPOC communities, right? And so oftentimes our interventions are focusing on an individual or treating symptoms. And we're saying that, you know, there are certain levels to think about, right? We can think about how systems might induce or perpetuate harm and trauma. We can think about the fact that so oftentimes communities of color think and need some sort of collective healing, right? And so by applying a framework like radical healing, there are several components that allow for this approach to really be grounded in centering, again, the voices and experiences of BIPOC youth and getting at that intersection of both racism and trauma. And so one part of that is kind of this collectivism approach. And so we are using a group-based model, and we are going to be focusing a lot on kind of storytelling and allowing folks to have a sense of support and community as they're going through the intervention. Another component is thinking about critical consciousness. And so a part of this is really being able to help youth critically reflect and act upon the environment around them. So being able to recognize inequalities that exist within society and hopefully elevating them to be able to feel like they can start by moving the needle by making some sort of individual or collective change and to address some of these issues that they experience or they see other people in their communities experiencing. We also focus a lot on this idea of building strength and resistance. And that, you know, that might look like being able to have a sense of, you know, yourself, having the sense of authenticity, working towards healing, and also tied to that, this cultural authenticity and knowledge of building pride in your own ethnic racial group, recognizing the strength of your group and the group, maybe the folks that came before you in terms of your ancestors, your community, and recognizing the importance for this radical healing to also be there, right? So being able to have solidarity and think about what transformation, what growth, what a future might look like, and being able to sustain and remain resilient and thrive despite inequities that exist within our society. And in addition to that, we build on pieces of recast, which is really thinking about helping you recognize racial inequities or racism when it's actually happening, and be able to understand how to address it in the moment in terms of what response might be best for them, and be able to implement whatever that response is, right? So we give them strategies based on recast to be able to be more in the moment, to be able to kind of calculate how they're feeling in the moments when they're having these racially stressful encounters, locate how they're feeling about it, where in their body, is it in their head, is it in their stomach, communicate about that, and also have some mindfulness mindfulness pieces in terms of breathing through it and problem solving through it. So youth will have the opportunity to do that throughout the intervention, in addition to getting some specific strategies. And I'm going to also walk you through really quickly some of the main components within the intervention based on the gathering. So if we can go to the next slide. So in terms of our focus, again, this kind of builds on that recast model. We want to help youth be able to name, respond, resist, and thrive in the experiences, you know, that are really hard, thinking about trauma, racism, and the intersection of the two. We really want to focus on building this ethnic racial pride for youth and help them be able to have racial literacy, the ability to understand and navigate through these racially stressful encounters, which can sometimes be traumatic. And we want to promote healing for them. And so we really have this two-prong approach when we think about healing. So a part of it is thinking about building this among the adult facilitators who'll be leading the groups. And the other part is building skills among the youth participating in the group. So again, we're increasing this education and awareness around this impact of general trauma and racism. And again, building this pride. And this is done through the different skills we've been talking about before. In addition to that, I think just a couple of things that were mentioned earlier that I'll re-highlight is that, you know, right now the Transform is 10 gatherings total. And so each gathering is around about 45 to 50 minutes. And we do have a facilitator training that adults must go through before implementing the intervention, because we do want to make sure that folks are ready and feel confident and competent to be able to have these conversations with youth. And if we could jump to the next slide, it'll just be quickly looking at some of the components of the gatherings. So just for a fast overview here again, we really start with grounding youth with what the intervention is all about, and we really model storytelling, and you'll get a quick snapshot of what that can look like in our fishbowl activity that's coming up really shortly. So we start with kind of storytelling. We want youth to get comfortable both being able to express these experiences and again, navigate and gain the tools over time to be able to recognize how they're feeling, name that, communicate that, be able to respond to that in a way that's appropriate for them and feeling supported. A part of that is helping to build their sense of identity. We do think about intersectionality within the intervention, so that is alluded to, but a big component of this, given that we are focused on racial trauma too, is building kind of this ethnic racial pride and identity. So we help youth kind of walk through that as well. In addition to that, we do spend some time helping them understand how folks are thinking about and how they are defining trauma and racism and racial stress and trauma. We also take the approach of having youth be the experts. So we want to hear from them too. So a part of this is a dialogue and understanding how are they thinking about it? What does this show up like in their lives? A part of this too is recognizing the systems that they're embedded within, right? And so we spend some time talking about what are different ecologies or contexts that are around you that could be sources of both stress and support. And so we spend some time diving into that a bit. In line with some of the pieces of cognitive behavioral therapy, we do spend some time exploring the connection between thoughts, feelings, and actions, right? So that's kind of the middle of the gatherings. And we address some things that sometimes are hard to address within traditional CBT, right? So what if there is a thought that everyone's out to get me, people don't like me? You know, is that an irrational thought? How do we contextualize that when we think about this intersection of racism and race and your existence within society? So we spend time really combing through that as well. And we go on to think about how to build these skills in terms of taking care of themselves. So kind of resting and restoring their bodies to promote this idea of strength and resistance. In addition to that, again, we're spending time helping to build their cultural ethnic pride and understand kind of the folks that came before them, understanding the strengths and the power of their community that exists now and exists previous to them, and kind of really helping to promote that sense of connection and identity. We have youth kind of talking about their stories throughout, but we'll provide opportunities for them to share their stories in ways that can be collective and that can be healing. And that will be integrated in ways throughout, but we'll be intentionally making space for that within the gatherings. And as we wrap up Transform, we spend time thinking about, how can they resist? How can they take action, right? So how are they thinking about the critical consciousness piece specifically, right, from the radical healing framework that we talked about? How are they analyzing and recognizing systems of inequality? And how are they feeling motivated and feeling like they have the skills and tools to navigate those things and hopefully be able to make some change? Because ultimately we're moving them towards also building the sense of radical hope, right? And being able to envision possibilities in the future and think about how they can contribute to change in the future. And we're not, again, just focusing on this individual level. We're also thinking about the context that they're embedded within and the larger systemic change that can potentially happen. So that is a very fast snapshot of the components and some of the skills and tools that we use in Transform. And we are going to now navigate over and transition to do a quick fishbowl demonstration.
Great, thank you so much, Farzana. So for our fishbowl, I'm actually going to spotlight some of our folks so that we can all be on the main Zoom so you can see all of us. And so this activity that we're doing is actually the first one in the first gathering. And it's really introducing them to the program, and we get into storytelling pretty quickly. We get into it right away. Okay, I think I found you all. I think I have to spotlight myself, right? Okay, all right. So Farzana and I are gonna play the role of co-facilitator, and then Latoya, Sazi, Anos, Ada, and Alex will play the role of high school students. And so in each of our gatherings, we have a script for facilitators to read off of. And so I'm going to read off of what we've come up together. So, hey, it's great to see everyone together. We're going to focus on a few things in our first meeting together. So why we're here, the focus of the program Transform, and we want to get to know each other through storytelling. So let me start by saying that I'm here to help guide us along together, but I'm not an expert. I have useful information to share with everyone that's based on science, personal experience, and also the lived experience of people who created this program. And I'm so excited to share that with you. So why are we here? So as you all recall from when you filled out those questionnaires before you came into the program, we're here because we are going to talk about how trauma really impacts our bodies and our brain, but also how experiences of racism can be really stressful, right? But we want to first talk about what is traumatic. It can be surviving a car accident. It can be witnessing two people get in a fight. It can also be called a really bad name based on your skin color, right? And being called that over and over and over again, that can actually be traumatic. We also want to talk about what is racism. You know, some of you may have heard a lot about it. Maybe some of you have heard a little bit about it. So we want to make sure we talk about what racism is, okay? And then we're also going to talk about systems. And what is systems, right? So these are like little circles that are around us that kind of operate close to us and then further and further away. So the ones that are close to us are like our family, the community center, right? The one that's a little further away is something like policy and procedure. That sounds so boring, right? But those are things like our government makes up, right? So I'm gonna learn a little bit more about that. So I'm gonna share a story, okay? And this is a story that one of the writers of the program agreed to share with you all. And her name is Dr. Fong Lao Johnson, and she identifies as an Asian American woman with a severe bilateral hearing impairment. So what that means is she wears hearing aids in both ears, okay? So what I want you all to do, as you're listening to this story I'm about to share with you, I want you to think about what are thoughts coming up for you? Are there triggers for yourself as you hear this story, what do you feel in your body? Where do you feel it in your body? And if you could maybe just jot down on a piece of paper on a scale of 1 to 10, just how big that feeling is. 10 being really big, 1 being really small, and it could be anger, it can be frustration, whatever feeling you want to rate, okay? So here's her story, right? So she's Asian American. She has a severe bilateral hearing impairment. She wears hearing aids in both ears. So she has this clear memory of when she was 15 years old and she had her first job at Baskin Robbins. So I don't know if you guys know Baskin Robbins, but it's an ice cream place. And I think there's still some around, but they've got 31 flavors. It's a really cool place to be, okay? But she was working there. That was one of her first jobs. And a customer came in while Fong was trying to make a drink with a blender. Blenders are really loud, right? So the customer's trying to talk to her, but the blender is going on, so Fong didn't hear her. So the customer gets really angry. And she said, "Do you even speak English?" And made these assumptions about Fong. And then she also asked Fong, "Do you need me to repeat it slowly?" Fong felt really hurt and embarrassed because she realized the customer probably didn't know that she was actually hard of hearing and couldn't hear her over the blender. The customer then said, "You know what, you're so stupid, go back to your country." And then the customer went to Fong's coworker instead to ask for help. So in this story, Fong remembered feeling really upset. She wished she had said something, anything, instead of just standing there. She didn't realize she had just experienced an act of racism. Okay, it was very stressful. When Fong went home to talk to her parents said, "We should just be grateful that we're here in this country. So it's okay, just get back in there and you'll be fine." But what Fong didn't really know was how to name what happened and how to respond, so her anger built over time. So I just want to pause for a second and ask you all, before we talk more about this story, would anyone like to share how you're feeling as you hear the story and any questions or thoughts? And Farzana, I don't know if you want to add anything.
No, I think that's a great start to just hear how people are feeling. So yeah, you all can share anything that's coming up for you, or you can even share thoughts as well.
I think I'm mad.
Mm-hmm.
Yeah.
I'm mad because it reminds me when I went shopping with my friends, and one of my friends was white, and I had money and she didn't. And we went in the store and everybody followed me around. And I was so angry. And she didn't even have $1 in her pocket. So it's making me really angry right now as I remember what happened to me.
Yeah.
Thank you for sharing that, Ada. Is there a part of Fong's story where you really relate to, maybe in the moment, how you responded or didn't respond?
I didn't respond because I didn't know what to say. I didn't know how to tell them to stop following me around the store. But I've always been told by my mom, just be careful when you go in the store.
Yeah,
it sounds like parts of Fong's story reminded you of your own experiences that you went through and triggered some anger for you. How did the anger feel? Like, did you feel it in a certain part of your body, or did you feel it to a certain degree?
In my head and my heart, like I was going to explode.
Mm. Oh, wow. Wow.
Yeah.
Thank you for sharing that, Ada.
Thank you.
I had similar feelings. Sorry, go ahead, Alice.
I didn't mean to cut you off, but it's really sad because that's sort of something that I think I didn't even think about, but it happened to me just as often.
Mm.
People said, like, "Where you from? You don't belong here. Go back." You know, it's like, go back where? To Seattle? You know, it's just like, yeah. Sometimes you just feel like crying, you know?
Yeah, absolutely. Thank you for sharing that, Alex.
Yeah.
I was going to say it pissed me off. And I think it reminded me of experiences that my mother has had and that I've witnessed her have. While she didn't have a disability, her very thick accent always caused people to question her intelligence. And so they always talked to her in a very condescending tone, and just reminded me of those difficult experiences to watch my mom have to try to navigate that while still saving face.
Yeah, thank you for sharing that. And it sounds like for you, you were connecting it more to seeing someone else being discriminated against over and over, and constantly feeling that anger and frustration for her as well. So it not even just your own experiences, but thinking about how that's coming up for important people in your life too.
Yeah, it just, I mean, I was really like near tears when the story was shared. It just reminded me when I had one of my first jobs as a teenager. And, you know, when you're learning the till and how to do the work, and people were like, you can't count and stuff like that. And I didn't know how to respond. I was just trying to hurriedly give them their change and whatever. But it's just really painful when people don't give you the opportunity to just be, you know. So just really reminded me of that.
Like, be a kid, right? Make a mistake. We're not supposed to know everything, right? Even adults don't figure it out right all the time. I know that for a fact.
Thank you for sharing that.
I felt like a really big tightness in my chest and in my neck during the story, and I felt really angry and sad. I kept remembering times when me and my friends would go out and they'd follow us around, and we would say that's racist, and then they'd tell us that it isn't, and then we get into fights about it. And then I have to think, is it? Like, am I just not seeing it right? And it just feels so, it really makes me angry and sad.
Well, you know, thank you everyone for sharing that. You know, I just want to kind of circle back to the story. You know, what we're trying to do in Transform is teach some skills, right? So there's something called the 3 R's, and it's, you know, being able to read a situation, recast it, and resolve it, but particularly racially stressful situation. And what we're hearing is that each of you have had something that was racially stressful. And so reading means being able to read a situation first, which involves recognizing when a racial moment happens and noticing our stressful reaction to it. And then recasting a situation, which involves what we call like mindfulness strategy. So we want to help take a moment that feels really big and overwhelming and reduce it to something that feels a little more manageable. And then we want to think about how we resolve situations. So you all actually did a lot of those skills without realizing it. And to do the 3 R's, we want to really focus on how do we calculate one's emotions, which is what some of you already did. You calculated your level of frustration or anger, right? How do you locate the emotions in your body? So some of you said tightness, right, in your chest, or felt it in your head, like building up, right? And then also identifying what communication is happening in your mind. All of you just did that right now. And so what we're doing in this program is how do we take those skills so that we can manage our emotion and effectively resolve it within a system that is unfair. So it's none of our fault, but the system still needs work, right? So we're trying to do these things while the system is working it out. Does that make sense? Okay.
And we're also hoping that it's going to help you be able to, the more you tell your stories, the more you can do these skills, that over time, this will come up naturally, right? So that in the moment, you'll be able to use these skills and these tools to be able to manage these situations, which sometimes will be stressful and sometimes might be really big and could even be considered traumatic.
Thank you for participating in the fishbowl. So what we're going to do is I'm actually just going to talk about real quickly the future goals of Transform, and then we want to open it up for any question. So let me go ahead and go back to, all right. So what we're focused on with Transform is we've been focusing on a lot of content development. And I wanted to, again, just really emphasize that this project really would not be possible without the Policy Council. And so I want to acknowledge for that work. And through the OJJDP grant, that's in collaboration with Community Passageways and University of Washington. So they've really been supporting us back in like CBITS plus RTM days and now with Transform. So it's been a phenomenal experience with them. So we're working on content development and nearly done. We're planning to pilot Transform in the fall. And the reason why there's a gap between June and October is because I'm pregnant and I'm taking maternity leave and I'm due in July 5th. Or else there would not be a gap, but that's why. But we're planning to pilot it next year. And so we're hoping this conversation sparked interest for folks. If you want to be a participating site, please let us know. And we want to get some preliminary data around feasibility, acceptability, and behavioral health outcome data. And then in 2022-2023 year, we're hoping to conduct a more robust research study with hopefully a control group, with maybe having at least one randomized control trial. And then looking ahead in 2023-2025, we're hoping it's ready for dissemination on a wider scale. We aim to have a set of trainers and consultants certified, and really want to honor our Washington board, who's been really instrumental, as well as the Policy Council, and having Washington State be kind of the lead in this program.